Hi everyone, welcome to my channel. In this video, today we are going to see about the disease condition called cataract. So, cataract is opacity in the lens or blurred vision. This is most common cause of reversible blindness. Reversible blindness is nothing but we can cure this. So, overall is getting affected by this cataract. So, 60% of people above 60 years is getting affected and 80% of above 80 years is getting affected. If we detect this condition earlier, there is a lot of possibility to cure this disease. Etiology, most common factor is age factor. Due to the age, cataract is common in the old age people. Then diabetes mellitus, increased glucose in aqueous humor can cause cataract. Then due to trauma, UV rays, steroid medication, or the congenital due to their ancestors, this condition may occur. Then coming to the pathophysiology, first the lens protein get denatured, then water accumulation will happen, then opacification. Opacification is nothing but between the lens, the cloud-like appearance will be occurred. Due to that, blurred vision will happen. Coming to the clinical manifestation, what are the symptoms it could be? The symptoms like pain, gradual painless vision loss will be there. Then glare, we can't see the object, it will be like glaring effects will be there while visualizing. Then we can't identify the colors and poor night vision. The night vision may be decreased and diplopia. These are the common symptoms faced by the patients. So what are the diagnostic tests we can take? So coming to the diagnosis, visual acuity testing will be done. What is the power of the lens we can test? Then slit lamp microscopy. These are all used in the previous days, and ophthalmoscopic and then A scan. That is intraocular lens. The power calculation of the lens is done. So during this test, we have to reduce the anxiety of the patient and explain the procedure clearly. By explaining the procedure clearly, we can reduce the anxiety and we can clarify the doubt of the patients. Then coming to the treatment. So for this cataract, we don't have medicine cure. If we give medicines, we can't get cured. So surgery is the only treatment to cure this thing. And in this, phacoemulsification is plus intraocular lens implantation is done. We can see detailing about this in the surgery. Coming to the surgical procedure, small incision is done, then lens is fragmented and the cloudness is suctioned and intraocular lens is included. Mostly or hardly it will take only 15 minutes to 20 minutes to do this procedure, and there is no compulsion that patient should stay in hospital. It is a small procedure. After this procedure, we can discharge the patient. Perioperative nursing. What are the care given to the patient before the surgery? So first we have to collect the detailed history of the patient, and they have to diagnose the test first. Diagnostic test should be done, and we have to collect the history of hypertension or diabetes mellitus, any past surgical history or any medication they are undergoing. Whatever the history is there, we have to collect it from the patient. And comorbidities, like comorbidities examples, as we said, hypertension and diabetes mellitus. So clear history should be taken, and then we have to get consent from the patient, whether they are willing to do this procedure or not. We have to get consent from the patient, and preoperative medication should be administered, and should educate the patient to be in milk or oral at least for 5 to 6 hours. Then eye drop is administered, and patient educate the patient that they should not bend or do any physical activities until the procedure is get completed. And medications like midriatics, cycloplegic drops are administered. Then intraoperative. Before the procedure or before entering, taking the patient into the surgical area, first reduce the anxiety of the patient, explain the procedure clearly, and provide emotional and moral support to the patient. Then we have to make the surgery area clean and sterile, arrange the articles for the procedure with sterile aseptic techniques, then place the patient in the position and check whether any ornaments or any metal items are wearing by the patient. We have to remove all those things. Then the monitor, we have to monitor the vital signs, provide patient in a comfortable position. Then as per the doctor's order, we can give anesthesia, or doctor will administer anesthesia. Then post-operative nursing care. Immediately after the surgery, the patient is done with an eye patch or eye shield for 24 hours to prevent infection or from the dust particles. Then we have to monitor for pain, bleeding and infection. Then educate the patient not to stress more and not to rub the eyes, and also to advise that not to sleep on the operated side. Then post-operative medications like antibiotic drops is given to prevent infection. Then steroids are given to reduce the inflammation, and NSAIDs are given to reduce the pain and inflammation. So what could be the complication after the surgery? So it could be endophthalmitis, like infections can occur, then intraocular lens dislocation, whether it could be the displacement of the surgical lens, then increased intraocular pressure and retinal detachment could happen. So in case of this, immediately we have to report to the doctor. This thing have to educate it to the patient. Next is patient education. So educate the patient about wearing the sunglasses after going to the home. This all should be followed. So educate the patient to wear the sunglasses, not to expose to the sunlight or heavy lights. Then we educate about heavy lifting and straining, and every follow-up should be done. After first day, we have to educate the patient to come to the hospital. Then the first week, educate the patient to come to the hospital. Then the 1 month visit is compulsory. Then educate the patient to use magnifiers and good lighting. It should not affect the eye lenses. Coming to the nursing care plan, patient may face blurred vision. So due to this, visual deficit will happen. So intervention, we have to teach eye drops usage, how to, because after the surgery also the patient might have feel the blurred vision thing. So teach how to use eye drops medications and all the indications to use the eye drop should be taught. And they will have anxiety, maybe due to knowledge deficit or lack of information about the surgery or the disease. So we have to provide education, explain clearly about the disease condition and the management, how house management should be done. Then risk for injury may be due to post-op precautions. So safety measures should be taken for the patients, like not rubbing the eyes, do not strain. All those things have to teach by the patient. So as cataract is nothing but a cloudy appearance in the eyes, It is a curable disease, so it only has the surgical interventions. Coming to the nursing care plan, we can reduce the pain and support to give the care. Thank